just to grab that.
Just grab that.
And then go right
Or
there.
go right there. Now, I like the back, but, you know, you've got a lot of, I am as I am. So, this, you can grab this one. There is a nerve, the sciatic nerve, which, you know, everybody's heard about, so you don't want to hit that. So, but if you grab this, you're not going to hit that. You feel that muscle right there.
Okay.
It's nice.
You feel like there's a pocket. You'll grab that whole muscle up.
Yeah.
Okay.
The whole muscle and go straight in there. Or the other alternative that I'll use, and I'll go in this muscle, is you can put your finger on the spine,
Okay.
and that way you know you're not hitting the spine, and make kind of V, and this is the epaxal muscle, and that's nice thick muscle in the back. So if your finger's on the spine, you know you're not going in the spine, and that's a nice thick muscle. That's my favorite, but he thinks it might be easier to, and less nerve-wracking, I guess, to go in the thighs.
Yeah, I probably would be nervous about
Going
getting
near
the spine.
Yeah, gotcha. So we're going to draw up 1.8, and I'll give you a bunch of sterile syringes. Do you have syringes, or do you just have the adequate?
I just have the adequate.
Okay, so there's 1.5, 6, 7, 8. So, and you don't have to worry about air bubbles as much as you think you do, you know. Knock a few out there. Okay, so when you're doing, you're going to just grab that muscle with an IM injection, and you can change the needle if you really feel good about, if you've gone through that to make it really, really sharp, and you can use new needles, you know, just to, so this is a brand new needle that hasn't gone through the rubber.
Ah,
And it's
I
also
see.
a small needle, but this is thin viscosity and low viscosity.
Yeah, it's shorter needle, so maybe
it's a shorter
you make
needle.
it more comfortable
Yeah,
with
so
that as well.
I'll give you some of these too.
Okay.
You're just going to have a lot of pressure because it's a small
Yeah,
needle,
so
small
we'll
gauge.
Ah, okay.
But it's tiny, and so you're not jabbing, you don't feel what you're jabbing. You're going straight in with an IM injection. You go straight in, and then you aspirate back to make sure you're not in a vein. So did you see me aspirate?
Mm-hmm.
Aspirate back, and then you just go straight in.
Okay, okay, I
And
don't
it
feel cold.
feels cold, it feels funny, and then you come out.
I know, what a good boy.